The African Union has launched a flagship campaign to intensify the continental fight against the Covid-19 pandemic. The campaign is designed to protect African economies and livelihoods amid the easing of lockdowns. Correspondent Gurun Chala has the story.
The campaign, Africa Against COVID-19, Saving Lives, Economies and Livelihoods, has been much anticipated. The African Union campaign was jointly launched by the Commission for Social Affairs, the Commission for Infrastructure and Energy, and the Africa CDC.
Saving lives, economies and livelihoods aims to utilize innovative tools, methods and partnerships with the private sector to develop harmonized strategies aimed at preventing transmission, death and social and economic harm on the continent. I think this campaign, we are not alone in this campaign, we are together.
The campaign aims to involve the private sector as much as possible.
Our countries and our companies and our carriers should start rethinking the processes, rethinking the way we do business to make sure that our systems are more adopting digitalization, that we are using more contactless or touchless means of providing services.
To 55 billion for
the head of the Africa CDC, John Nkengasong, noted the mounting impact of COVID-19 across Africa.
We are at a very different phase of our pandemic. We have crossed the 1.1 million mark, and countries are easing the lockdown. And as Commissioner Amani said, the loss of economic loss just for travel is about 8 billion and about 50 to 55 billion for tourism on the continent alone. So at this point, we needed to devise a strategy that will protect both travel and borders, protect economies and businesses, and protect schools.
The African Union has launched a number of initiatives to combat the pandemic. For instance, the Africa COVID-19 Response Fund, which pulls a resource for anti-epidemic supplies.
There is contributions from member states, there is contributions from our development partners, and the fund is playing a very big role in purchasing the medical equipment needed in our member states.
For most African countries, the worst when it comes to the COVID-19 impacts is yet to come. Many nations still remain underprepared, populations undertasked, and the campaign efforts underfunded. Both Africa CDC and WHO advise African governments to step up their efforts and do it fast.